Morning.
Good morning.
Tuấn ơi, muốn đỡ con cột thì làm buổi sáng sớm phải có một.
Oh, I think we can start, Ross. Oh, you mute.
Good morning, everyone. Can you hear me?
Yeah, we can hear.
Yeah. Hi. So before I begin, I'll just some ground rules here, right? If you have questions along the way, feel free to speak up. You don't have to put inside the chat message, but if you want, you could. I'll try to check the chat, the message box once in a while. I understand that some of you here are not that fluent in English. I will try to speak as slow as I can. If you think I'm going too fast, please let me know and I'll try to slow down. Okay, so let's just begin. First of all, I would like to talk about team. Team is basically the crux of every startup, including biotech startup. In building a team, there are three core things that you would want to consider at the very start. One is, should you be building a virtual versus a brick and mortar company? And what does that mean? I will share about that in a later slide. But basically, the first thing you have to ask yourself is whether you have the capital to build this brick and mortar company. Brick and mortar means physical, having your own physical lab, putting investment into overhead and fixed physical assets. So the answer is most of you wouldn't have that, right? acquiring capital is extremely difficult, if not impossible, until you have passed through considerable amount of risk, meaning that along the way you're expected to reduce risk. And so what are these risks that I'm talking about? Anyone? What do you think the risk of a biotech startup is? Care to share? If not, I will go ahead. So the risk could be technology risk, intellectual property risk, clinical trials, and even the team, right? However, the reality is you need to make progress to be able to attract investors and to be able to grow your company. Therefore, the founders most often would need for a start to acquire non-equity resources. So the key point here is non-equity, meaning that not raising from investors, but in fact acquiring non-equity resources elsewhere. So what are the non-equity resources? It could be government grants, it could be from Economic Development Institute, or it could even be selling services that you would be able to provide to clients. Alternatively, if venture capital funding is not available, especially for very early stage startups, the alternative is to go to individual angels to raise a limited amount of seed capital to get you started. So it is beneficial to do so to increase your capital and at the same time to reduce the dilution. So what does dilution means here? Meaning that not reducing your capital in the company, your shareholding in the company. So in other words, that you are recommended to leverage on other resources. So this could mean if you are from the academic institution, the use of academic facilities, that there are programs like that available for scientists or researchers that intend to start a company, to make use of facilities that are available at a reduced cost or almost at no cost. Or you could outsource your product development and clinical work to others. So it is recommended that you do not invest, as I said, in physical facilities, except for the bare minimum. Instead, you would want to invest in what? In key people who may or may not join the company full time, bearing in mind, as I said, if you're a startup, you would have very little capital to start with. It may be, you may not have the capital to hire full-time employees. And so in other words, you would have to rely on that first 1 or 2, 3 key founders to fill in multifunctional role. So this is at the very, very beginning of your startup. Obviously, when as the startup progresses, you would expect that to evolve. So eventually, once you have progressed, you've hit certain milestones, you've raised a bit of capital, you would want to consider going from a virtual, meaning that purely having key people, leveraging on facilities that are available, to locating yourself into your own space. And that is possible because nowadays, I'm not sure whether in Vietnam you have such, but I believe in most countries they do have facilities like science park, incubator space, where you could rent at again a reduced price and also to use the facilities there. So in summary, in a virtual versus brick and mortar, the key thing is that In virtual, you do not invest in hard assets, physical assets, but instead you invest in soft assets. Soft asset meaning mainly key hires. The next thing that you would want to consider when you look at building a team is balancing science and commercialization. So I believe that most of you here are, in fact, scientists, right? To you, what is the most key in building a startup? Is it science or business? So for me, it's neither. It should be, in a way, balanced. Sometimes you may find a need to focus more on science and sometimes on business, right? In biotech and biomedical companies, there is always the need to continually advance the science. So science never goes away. You would have to prove the principle, then you build the platform and the IP portfolio, then you build more on top of the IP portfolio and continue to innovate. However, progress down the commercialization pathway is necessary to generate the funding that will be needed to attract your subsequent team members. So there is a sense of urgency to advance both the tech and the business, and to have to be able to establish early on, not later on, at the founder and the board level, and to manage carefully the CEO, the CTO, the CSO of the company, who are the key people of the company. So the good thing is that for a biotech company, most of you have that kind of initial relationship, right? In fact, some of you spun off from the university or research institution. So you do have those ties which you can leverage on. And as I said, that it's not necessary to have your team full-time. So this is one way that you could leverage on relationship with universities or research institution, meaning on a contract basis, say for example, outsourcing certain work to teams within the university. But one thing that you need to be careful of is the IP and the conflict of interest. Commercialization involves, in a nutshell, clinical demonstration in parallel with product development. So it's not that it doesn't go hand in hand. You have to consider both at the same time. And this is something that is not easy to do, especially for biotech startup, because you are, after all, operating in a regulated environment. So now that you have built your team, you have to also consider how do you go through the various phases of the startup. So there will be transition at a certain point. And the question is, does your team remain the same? Meaning when you have these 2 to 3 founders and then key employees, and that's it, the 2 to 3 founders will continually lead the company to IPO or to exit, not necessarily true, right? Along the commercialization pathway, company leadership and the board will need to deal with the evolution of the team. Okay, not just your employees, which you would see that you would need to change over time depending on the stage of your startup, but including the founders or the management team. So for example, you as a founder, if you started off as a CEO, the most likely case is down the road, you may cease to have that dominant role and allow for someone with a more relevant skill set to take up that leadership role, especially in bringing your startup to to clinical trials and to commercialization, and to raise funding or even partnership funding. So there is no fixed or perfect formula for how you deal with transition. Okay, but it will happen eventually, and this is something that you need to realize even at the very beginning, to make sure that you are indeed prepared for it. If you all have questions, please stop me and ask. So, who are the core team members in your first initial stage startup, right? How many do you think there are in a core team? Usually it's very small. Okay, you can count by just 5 fingers here, right? 2 to 3. Start with small core team, and then which basically consists of you as founders. It could be 1 to 2 or 3, and a few part-time consultants. And again, I go back to the very reason why. It's because you most likely wouldn't have the capital to hire a full-time team. And possibly also mentors. Mentors are very critical, very crucial at your very early stage, especially if this is your first time venturing into starting a business. And they are very helpful in terms of guiding you, not just in terms of the business aspect. Sometimes it could be on the technical, clinical trials, regulations, IP, portfolio, and they could also help to locate the advisory board members and directors. So this advisory and directors are what we call your periphery members. They provide good advice and they add to the credibility of your team. If you run just a biotech company with a small core team member, this is something that your investors and partners look to especially because again, they would want to see who are you working outside of your core team. Do they have that credibility? Are they trustworthy? Can we talk to them and learn more about your startup, about your product? So it's very important that you find the right advisors and directors to surround you at the very early stage, especially. So what are we expecting from directors or advisors? So in this early stage, which is very critical, a set of directors or advisors have to bring specialized expertise, connections, access to networks for funding, partnering, hiring, markets and customers, almost everything that you could possibly name, right? Especially for you, which lack in certain areas, for example, in regulatory, clinical trials, IP, corporate agreements. They also provide mentorship and advice from their experience. And they ensure, and this is the one key thing for board of directors, is that they ensure that you go according to plan and that you fulfill your fiduciary responsibility. So in most cases, if you see scandals that happen along the way, so for example, Theranos, right? One of their failures is the failure to equip themselves and surround themselves with the right group of periphery members that basically keeps you in check, right? Hey, are you doing the right thing here? Are you fulfilling your fiduciary responsibilities to your shareholders? And that's what you need as a startup and eventually as you evolved as a company. So initially you have no more than 3 to 5 signs of business advisory board members which hold a non-fiduciary position. And then you would have 3 or so board members. And you must make sure that at least one are outside of the core team that would lend to the credibility of the startup. So again, like, what are the key difference between a board of director and a board of advisors? And as I say, board of advisors, their key responsibility is really on the fiduciary control. They provide you with an overview of the strategic direction and your operations, and they ensure that corrective actions based on internal and external changes are implemented. And advisory board, basically they give you a broader sort of advice, right? Perspective as well, be it on science or technology or in terms of clinical development. Then there is also the other one that we tend to lapse in considering, which is the attorney. And why most startups ignore this is because they tend to think that attorneys are expensive. Why do we need to engage them at the very beginning? But I think it's important. There will be an example to show why sometimes an attorney is key, where you should involve them, especially in terms of your legal paperwork and such, right? In terms of putting together your IP portfolio, but also in terms of handling compensation, stock compensation as well, corporate partnering issues, especially with your employees and your advisors. So now we go to the employees, right? So we talk about why it's key to have an attorney on board. As a startup, you obviously cannot reward your employees with the market rate compensation. So then there will be a mix of cash compensation and also stock options. So there will be negotiation about this. There will be expectations of having stock grants or options. And you want to make sure that you do this well to avoid any issues down the road in terms of the legality around the issuance of stock options. Okay, so let's look at this, right? Who are the people behind the biotechnology startups? So can anyone from any background start a biotech startup? Meaning that if I don't have a biotech education or experience, can I start one? In fact, theoretically, yes, as long as you have the idea, the skills, and the motivation, anyone could start a startup, right? But the odds are stacked against those who are not part of these 4 categories. So what are these 4 categories? They are all linked in a way or so to the biotech sector, right? The first is the academic scientist. So academic scientist would mean scientist, physician, bioengineer who comes from the academic institution. And the academic institution here broadly is defined as university or research foundation or even non-profit research institute. And then you have the industry scientists, who are also, again, scientists, physicians, or bioengineers, but will come from the life science industry. So by life science industry here, meaning from another biotech company or a pharmaceutical company. So the business person here is usually a former executive in a life science company or a biotech pharma company, or even a venture capitalist who has worked on life science deals. And they are not like the other two in the first two category. They are most usually not scientists, physician, or bioengineer. But the key is that they have worked in the biotech sector. And the last group is a core group of individuals that have spun off from another life science organization. And in this case, universities, research institutes, and in some cases, it could also even be from biotechnology companies or pharmaceutical companies. So out of these four, who do you expect would be able to raise seed capital faster? Is it the academic scientist, the industry scientist, the business person, or the spin-off team? No answer. So it would be the spin-off team. And why I say that is because they, in most cases, a spin-off team would have already in place capital available, either sponsored by the institution that they are coming out from, or by some other organizations that they have connections with. So they have very deep connections, business connections, I would say, that would allow them to be able to raise seed capital faster. Then, of course, you have that one or two business person that come out to set their own biotech company. They would have the experience to be able to also raise seed capital faster. And then, of course, then it goes down to industry scientists and then to academic scientists. So academic scientists are mostly really very good at hands-on bench scientists, right? But they lack the industry experience and network. Eventually, they would be able to raise the capital by the validation of their technology and product. So I would like to state this right clearly, that biotech entrepreneur, please don't tell the other tech entrepreneurs, are unique from the rest, right? It's not just that you have to possess whatever the entrepreneurs possess, the same attributes, right? Like independence, confidence, perseverance, desire to take the road less traveled, ability to work long hours, willingness to take risk. There's something different about you. And what is that? One very obvious obvious thing that you would notice, and I've noticed this because I've seen lots and lots of presentations from both sides, right? From the biotech entrepreneurs and from the tech entrepreneurs, is that you usually consist of accomplished scientists, and all of you here are, right? Researchers, bioengineers, physicians, or business person. And then what you have behind your name, PhD, MD, MBA. So you are, most of these entrepreneurs are highly qualified, highly educated, highly experienced, and for that matter, well paid. And they have a very secure position, and that could be a plus or minus. They are so comfortable in their position that does it make sense to come out of your comfort zone to start a biotech startup? Then the other key difference is your time horizon. How long does it take for a general tech startup to launch their product? It could be within months of their incorporation, right? But for a biotech startup, it's different. So if you're like a therapeutic or biologics startup, it could take you even upwards of 15 years before your product gets to commercialization. And then for diagnostic or medical devices, although it's shorter, it's still, it takes a longer time than the average startup. It could be 3 to 7 years where you need to validate, do your proof of concept before you are able to commercialize. So in other words, you bear both the technology and also the regulatory risk, and also the financial risk in starting a biotech startup. So before we go on, let's look at Genentech, right? Which profile do they fit? Is it the academic scientist, the business person, the industry scientist, or the spin-off? Anybody here familiar with Genentech? So maybe I'll share, right? Look at this. Obviously, this is the scientist and the academic scientist, and this guy here is in fact a venture capitalist, right? So both of them came together about 45 years ago to form Genentech. This guy here is Robert A. Swanson. If you Google, you'll be able to find his name. And this well-known biochemist, Dr. Herbert W. Boyer. So if you know Boyer and Cohen are the pioneers in recombinant DNA technology. So at that time in 1976, you've never heard about this, right? Robert, like any venture capitalists, are always up to speed on what are the trends in technology today. So when he found out about the recombinant DNA technology, he made a call to Boyer just to talk and to express his intention to start a company together revolving around the recombinant DNA technology. So he managed to secure, especially at that time, with someone as well known as Boyer in the life science field, 10 minutes of his time, which then expand to 3 years. This is stuff of legend. 3 hours, and then by the conclusion, they form Genentech. So Swanson and Boyer is what in fact, and Genentech is in fact one of the the first modern biotechnology companies. I will share a bit about that in a later slide. So when you look at this and some other examples, then the question comes to mind. You are a scientist, you're not a business person. Can you actually transition from a scientist to a biotech entrepreneur? Or can you even be successful at the start, right? With lack of business experience or connections. The good news is that the largest majority of biotech entrepreneurs in fact come from the scientific background. They built their business experience for the lack of over the years. So fundamentally, as scientists, and I think you would know that, I would know that as well, when I transitioned from researcher to a venture capitalist, that we love working with things and experiments. We are people shy at the beginning, not all, but generally we are. And the thing is, when you start a biotech company, you are expected to work with people, not just things. And this is something that it's a right that every scientist would have to go through in forming a biotech company, transitioning from being comfortable with experiments only to being comfortable with working with people as well. So there are examples, not just this, not just Spoyer, but within Genentech itself, of successful scientists that eventually became a leader, business leader in their own right. So one of them is David Godel. So if you Google that, David Godel was in fact a successful scientist in Genentech. Then he went on to start his own company, biotech company called Tularic, which was later acquired by Amgen. Just to let you know, Genentech was later acquired by Roche, and both companies were acquired past the $1 billion mark. So what about if you are a business person? Let's turn things around, right? If you are a business person, then how does that work? The key thing for you as a business person with lack of technical experience is to be able to communicate with scientists and to be able to understand the limitations of technology. This is always a conflict between the business and the technology. Sometimes the business do not understand that you can't just snap your finger and you get great results and expect that to happen with the scientists. So there is always that constant learning, trying to understand the scientific issues, that product development can be delayed, and to be able to communicate rightfully with the scientists. So that is a different challenge for the business person to face. So now that we talk about the life science company, what are the two critical people roles that are necessary to start a life science company? It would in fact be the chief executive and the chief scientist, right? But then if you look at this, why am I separating the founder from the chief executive and chief scientist? Aren't the founders always one of those big C's? Not necessary. I think, and you will realize this, it's a very common model in biotech companies, especially in the Valley, where the founders are not necessarily the key shareholders or even the key chief executives or chief scientists or whatever it is. They normally play an advisory role. They would remain in their academic or research position and lend their support to the core team members, which they would have to scout for. So that is why you will see this separated. They are the link to the founding concepts because they are basically the brainchild behind that. So you will see that everyone here, every key role here would play different roles in the company, but there's one common, almost common denominator, and that is fundraising, especially at the very beginning of the startup life cycle. Everybody needs to chip into fundraising. It does not mean physically putting yourself in front of the investors, but in terms of putting together the resources and information to be put in front of the investors. Now, building this effective team doesn't happen overnight. It happens in phases. So there are 3 phases here, and it is also a sort of reiterative process, right? And it's not just one dominant thing. It could be a lot of different things that you will need to evaluate and then to go back to if things need to be pivoted or changed or doesn't go your way. So for phase 1, which is basically task analysis, which is analyzing the tasks to be performed, you would want to ask what is the work that needs to be performed and what is the focus? Is it validation, fundraising, getting the team up, or determining your market or customer? And once you determine that, what authority or autonomy do you accord to one person or a team to work on this specific task that you have identified? What is the degree of interdependence you're expecting from the team members? And how do you align their interests with that of the company? That's also very key. Then once you've determined that, then you moved on to phase 2. Phase 2 is where you put together the people required to perform the tasks that are identified in phase 1. So to be able to achieve at least the first or the next milestone, then you need to determine how many people are needed, what technical tasks, management, and interpersonal skills are required, and what diversity is optimal for the team. Then phase 3, which consists of the processes and procedures, meaning putting actions into place, right? How do you put together research, collaboration, partnership, or licensing, and getting to growth? What are the explicit or implicit norms that are conducive to the performance of the company? Is something being ineffective, then do you need to go back to task analysis? So let's look at Genentech, for example. So the phases that they go through, right? Genentech, when they started, they started with venture capital funding of 100,000 from Kleiner Perkins. So 100,000 at that time is quite significant because that was like in the 1970s. So the first logical step for them is, as it is, to begin experimenting. And for them, the vision is really to synthesize insulin. So their first step was to begin experimenting with the procedure for the synthesis of insulin. And that is what? That is basically task analysis. And then Swanson, in order to have this, to kickstart this, Swanson was made the president, obviously. And then they went on to engage the Boyer Lab, and Boyer is obviously one of the founders, as well as 2 other labs. And what you call this is basically a subcontract. So if you look at this example, Genentech is in fact following a virtual model that we speak about a lot today. And in 1976 is something that was not really conceptualized, right? So, however, these scientists from these labs quickly realized that they need to be more practical in their approach, meaning they need to take a stepwise approach rather than immediately engineer a bacterium that synthesized insulin. They instead choose to look at a less ambitious task, which is to synthesize somatostatin. This is a smaller hormone, so in fact, it would have been easier to synthesize. Now, Swanson, the business person that he is, resisted at first, obviously because his vision is to synthesize insulin. Why not go all out and do it? But eventually he ceded to their request and their advice, and agreed to work on somatostatin instead. So this is where task analysis phase 1 is done, and it's a form of reiteration. So in order for this to proceed, Swanson put together and established official research agreements with 2 institutions, one with the University of California and the other one with City of Hope. Then he also managed to raise $850,000 to jumpstart this somatostatin research. So this is what we call the processes and procedures. So by August, by 1977, they managed to create the first bacterium capable of synthesizing somatostatin. So it was a success, no doubt, a smaller success than what they would have wanted with the insulin. They went on to hold a press conference, PR, media attention. That is key to be able for them to generate interest, not just from the public, but from the investment community to be able to raise the next round of funding. So following this, Swanson then said that, okay, so we have the somatostatin down in place. Let's go for the bigger goal, which is insulin. And at that time, it is critical because to their knowledge, they know of 2 other teams that are working on synthesizing insulin as well. So in order for them to speed up that development, obviously he needs to get more things in place. He gotten a space, which is a warehouse, and basically changed that into a lab space, and also managed to secure a partnership with Eli Lilly, where they were given $50,000 a month just to work on the human insulin project. So in between all this that is happening, there's always a back and forth between task analysis people, required process and procedure, right? By 1978, they managed to synthesize human insulin. And that was in fact a big success, because then they went on to negotiate a multi-million-dollar contract with Eli Lilly. So in 1976, that is very rare, in fact. And this is the beginning of that big company, small company relationship that you see happening a lot today. So Genentech was in fact that template used for building this kind of partnership, licensing partnership relationship. So while there was still, while they were successful in this, then they went on to look at other things that could be done, because their intention was not just to be a small biotech company that rely on external funding. They want to be independent and to be a sustainable company. And this is what you would typically see in the progression of biotech companies today, from a startup that rely on licensing partnership or VC financing to an independent company. So for Genentech, they were looking at, with the $1 million contract, they were looking at other things, molecules, interference, animal growth hormones, hepatitis B, and most importantly, human growth hormones. So that was the direction that they headed to become a sustainable biotech company. And that basically also includes processes and procedures that they need to put in place. So as an entrepreneur, your decisions are centered around these core factors, right? Capital needs and timing, competitive landscape, changing regulatory landscape, scientific results and capability, target market and forces, and intellectual property protection. I'll go into competitive landscape a bit because it's a bit different to what a tech company would do, right? They would look at what is generally out there in the market, who are my competitors, how does my competitive landscape looks like, who are my direct and indirect competitors. But you as a biotech company, you'll have to do more than that. You'll need to know what's in the pipeline. So for example, what are the things that are undergoing clinical trials? What are the trends, right? Whether it's it depends on what sector you're coming from. You need to be basically kept abreast of what are the key developments in your sectors. Obviously, if you're a scientist, you would have access to academic journals as well, which would also give you insights into what's up and coming, what's the trend today in your specific sector. So now that these are actually interlinked, they have the ability to impact the other factors, right? So for instance, if decisions are made in choosing a specific target market, that would likelihood affect the interest of the investors and your ability to fund your startup. And then with that, it will also affect, because the capital that you have now being able to raise are limited, and it will affect the ability to recruit and retain the best technical staff and resources to go ahead in developing your product. And the product development choice that you make here, right, based on your limited resources, would also affect your likelihood of securing regulatory approval, where else the ability to obtain regulatory approval would then again impact your ability to attract investors' interest. So you must be aware of how these are interlinked and how each will affect the other, whether now or whether the future. So what should early investors be able to provide? They are, of course, one of your key stakeholders, especially in the early days of your startup. The most obvious is they are able to provide capital that's needed. They are able to connect you and put you in front of the people that matters to your company, be it for future funding, whether it's advisory in certain areas of technology or business, or getting you that industry connection that you would never have been able to do as a startup. And for certain VCs that are well known as a life science investor, especially, that increases your ability to attract future funding from other investors if they know that this particular VC has invested in you. Then the other thing is valuation, right? whether you are undervaluating yourself or are you going overboard with your valuation, you need to be put in check on this. And who better to advise you than the VCs that would naturally know what is basically the market valuation for such and such company at this particular stage of the startup. Okay, so these are questions for you to reflect on, that you could look back after the workshop and whenever you start with, you begin with your startup. Any questions here before we go to the next section? No question, then I will proceed. So I believe that, sorry, is there a question or not? No. So I believe that you are under either of these categories, right? Whether drugs, and I put drugs because that covers small molecules, biomolecules, biologics, platform tools to assist in the identification of drugs. And then you have the medical devices, diagnostics, food and agriculture, health, IT. What we will be focusing on, as you will know, today is really on this tree, which is drugs, medical devices, and diagnostics, right? So just a brief: therapeutics would be small molecules, peptides, and nucleic acids, and then biologics and vaccines, which are basically biotech startups, the oligonucleotides and antisense, proteins, monoclonal antibodies, stem cells. And then you have the diagnostic, in vitro diagnostics, molecular diagnostics, predictive and prognostic, companion diagnostic, personalized medicine, and clinical laboratory services that fall under this category, and the medical devices. So as a life science company, what is critical to you, apart from team, which I mentioned at the very beginning of the workshop? Is it intellectual property, scientific data and validation, venture funding, which is money, non-dilutive funding, lab space, collaboration, or publication in peer review? I think for scientists, this is very critical, right? Publication in peer review, to be recognized for your work. But interestingly, as a life science company, that is the least critical factor to be considered. And again, this is one of the reasons, is also it has to be aligned with your IP strategy, which I will talk about later on. So the key factors here is, in fact, intellectual property and scientific data and validation. Obviously, if you have clinical data, that is better, but as a startup, you may not have that, then scientific data and just validation would be appropriate. So I did say that I was going to go a little more in depth into virtual biotech. So what is virtual biotech? In essence, it is basically outsourcing of all the non-core activities and reducing the need for in-house labs. So instead, your team are basically small, and it manages the execution outside the company with, say, for instance, contract research organizations that were hired. And this is a known model. In fact, most startups would, knowingly or unknowingly start as a virtual biotech. So some of these successful virtual biotech that eventually exited are here, listed here, X01, Ferrokin, Artius, and so on. And they principally focused on a specific clinical stage assets. Again, you play within the limitations of your resources. If you ask me, I would strongly advise that you start with a virtual company instead of equipping yourself with all the high-end instrumentations and physical assets that you think would give you that competitive advantage. Why? As I said earlier, the key is to put the money into the right resources, and that would be your key hires. So virtual company works regardless if you are a biotherapeutic company, diagnostic, medical device, agri-biotech, or any other sectors of biotechnology. During the startup stages, capital is usually quite limited, and a company cannot hire many full-time employees, but substantial progress must still be made in order to gain interest from investors and to achieve certain value-added milestones. So these companies, right, may initially start off with one or few key employees, and they utilize the experience of consultants who are paid nominal fees. But they instead will receive, as I earlier pointed out, stock options as incentives, while you contract out most of your non-core activities to contract research organizations. So sometimes your R&D personnel, they will come under a temporary or a part-time agreement. So they, again, as I said, compensated in both stock options and cash. So what are the issues that can arise with this kind of setup? Intellectual property ownership. So that's very important. There will be one case study on that later on. You need to make sure you discuss all your employment and compensation commitments with your attorney. That's why I say that it's important to also get an attorney to help you initially to draft the necessary documents that will prevent these IP ownership issues. So for R&D outsourcing to be successful, what needs to happen? You need to maintain a good working relationship, identify the right partners to work with. And for many of these companies, right, the extent of outsourcing may be significant, where, for example, you may outsource almost all development functions, or it could be less significant where you outsource some. So there is basically a scale from extensive virtual model to less extensive virtual model. Because of the great, the expenses, right, with R&D, with preclinical animal testing, naturally most would opt to go virtual until significant funding is gained or significant milestone is reached, which can support your hiring of internal staff, getting the expensive equipment that you've always wanted to, and in-house activities. So sometimes, right, these R&D activities are kept in-house because they are specialized. So you need to know what can be outsourced and what cannot be outsourced. But obviously you want to outsource as much as possible to keep your costs down, which is your overhead and your fixed costs. So companies that successfully do that, they would be able to keep it as low as 10 to 15%. So if you look at this background of virtual biotech, they are initially started in response to the high cost of capital for startups and the burden of fixed infrastructure, which we are able, as you can see, to resolve with this kind of model or setup. So, and it has become even more possible today with a rich CRO ecosystem. And why I say that, you have lots of pharma biotech companies, talents that have moved on to others. And then you have up and coming territories like China and India that are now offering high quality CRO services with improved communication, customer interface, and they are less expensive than you would have to attain previously from CROs that were mostly based in the West. So operating virtual company, especially during your early stage, enables you to extend your time horizon. And I would say that in terms of the need to acquire capital. So you are able to sustain your company for longer and instead focused on what is really critical, which is the drug discovery and development of your product. There are still some issues with virtual biotech, especially in this part of the world today. Founders require salaries, and especially as I said, that most of you come from very, very good education background or experience, comfortable salaries. Would the founders be willing to part with their salaries? And then that raises the question of how committed are the core team to this model? Like, what are they doing if you are not, physically in the lab? And then investors' acceptance of this, DUB is becoming sort of natural for a lot of the developed countries, but this is something that is less familiar with investors in this part of the world. So can the investors here accept such a model? One thing to note though, that the virtual model, as much as I am promoting it, is not something that you want to carry on for the long term. Okay, eventually you will need to build your internal value and possess the internal expertise, which you cannot do with just a virtual biotech company. So in other words, you can start as a virtual company, but this is temporary, and you should look ahead on how you could evolve into a biotech company that has more and more internal resources and value to your advantage. So let's look at this value enhancing milestones, right? We are going to look at the therapeutics and biologics first. As you jump along these milestones, right, from here up towards here, you will see the increase in value of the company. And you should recognize these key milestones. Okay, this is just a general sort of overview, but for specific companies, you will need to look at what are your specific value enhancing milestones that would add to product development and would increase the interest and confidence from stakeholders in the company. So when you outline and you achieve these milestones as a company, you'll see your value increase. You're able to attract stakeholders, especially funding, in order for you to jump ahead to the next development stage. So value is created, if you look here, incrementally. It's not like you jump from here straight to here, right? Which you can see some tech companies being able to do that within a year. You need to get through each and every step along this way. So when you complete these milestones, you add more value, And with each successful milestone reached, you are expected to have your risk reduced, right? So let's go I will sort of go fast on this because we're going to talk about this in the next session. We'll start off with completion of basic and translational research, then to in vitro testing, to lead or process optimization, to completion of preclinical animal testing. Then you file your investigational new drug application. Then you complete all 3 phases of your clinical trials that will lead to you filing the new drug application or the biologics application. Then you get the regulatory approved. Then you're able to scale up manufacturing, and this is where real revenue is generated, marketing and growth. The question is, where do you sit in all this, right? Like when do you start a company? It could be at this, but you will see a lot commonly in between this where scientists start to come out and start their company. And acquisitions would normally happen along this as the value of the company increases. So I mentioned here, new drug approval and biologics, right? What are the difference? There is a difference in the value enhancing milestone, primarily because biologic is, after all, a large molecule and it's complex. So in other words, the manufacturing process is different, it's more complex. So for instance, if you have a slight change made to your temperature along the manufacturing process, the regulatory agencies would expect you to file for that change as well. So these like increments of this would be expected to slow down your progress towards value enhancing milestones. Then the other thing is that your small molecules, which are the drugs, are often more stable in most environments. So if you notice this, most of the small molecule drugs, you can administer it orally. But for biologics, because they are they're not stable, fragile in fact, they are most often administered through the bloodstream, which is basically through injection, right? So those are the differences, like the delivery routes that you need to consider. So if you look at medical devices and diagnostics, similar thing, you have that value enhancing milestones along the way. And as your value increases, your risk is expected to reduce. Similarly, you start off with translational or basic research, then you moved on to proof of concept, prototype development, clinical validation, your 510K or pre-market approval, then to manufacturing and to marketing. So in clinical validation, the key things that the regulators and in fact you as a startup would look out for is the sensitivity, the specificity. Typically you'd want at least 80 to 90% in that order to be significant, right? And this is something that the physicians or what clinicians would need to know in order to help them assess the reliability of the diagnostic tests. And they would then be able to have to make a more accurate clinical diagnosis based on this information. Then the other thing that you would need to provide for is what is the positive predictive value and the negative predictive value. The positive predictive value means the likelihood that a positive test would be correct, and the negative predictive value likewise that a negative test would be correct. Then the other measurements that the regulators would look at as what are the incidence rate and the prevalence rate. So when you file for your 510K or PMA, when you reach this station, you'll need to determine which are you going for. Typically, most diagnostic companies go for 510K, which sometimes is known as pre-market notification, compared to the more rigorous pre-market approval. These are when there is more risk, safety risk concerns in the particular product that would mean that the company would need to go through the pre-market approval instead. So there is a difference between this 510K and pre-market approval. 510K to the authorities means that you are cleared for marketing, whereas pre-market approval, as it is said, is basically you are approved for marketing. So what clearance means here is that, in fact, you have already a substantial equivalent product to what you have that was already placed in the market. And so in that case, you can go for the 510K. So more details in the next session about this, but that is in brief about the medical device and diagnostic milestones. Now, I would like to touch a bit on this because this is really, I would say, the next or the trend that we are seeing today. The whole field of AI-based novel targets has experienced significant hype, okay, in recent, like these 2 years, just these 2 years. Like in 2019 alone, you see significant partnerships, about 20, between major drug companies and AI drug discovery tech companies. AI in drug discovery and development is estimated at 603.5 million. Okay, and it's growing significantly, double digit at 28.8%, expected to grow, I mean. So, but if you look at this, there are really just an emerging segment of the 53.4 billion drug discovery market. In other words, there's still a lot of room for growth. And what signs do we see? In the investment space, we are seeing a lot has been raised for drug development in AI, 13.9 billion to be exact. And this, in fact, is the highest of all AI startups, so you can see that there's a lot of interest in drug discovery, AI-related companies. So example of these companies, for example, Exscientia, they announced the first AI-designed molecule for immuno-oncology and entered human clinical trials. And the interesting thing about this is they took less than a year from conception to trial ready. And if you are familiar, I believe you are familiar with this, it takes years, in fact, to reach to that stage. And this company has proven that with AI-designed drug discovery, you are able to shorten that phase, the preclinical phase of the market. The other company, which is better known, which is In Silico Medicine, a Hong Kong-based drug development and discovery AI platform, raised 255 million, I think just a short while back. And this too, and the other companies that raise funds are an indicator that there is a lot of interest from the investors and naturally from the industry into this sector. And their premise is really that they are identifying novel drug targets for untreated disease. They assist in the development of the new treatment, and eventually they are able to predict how well these treatments perform in clinical trials, something that you were not able to do prior to the AI drug discovery evolution. So in silico, we're able to raise from the big names investors, and we are expected to see this trend continuing in the future as more and more such AI drug discovery-based platforms raise funding. One thing to note here, if you're considering this, is that these companies were able to condense, like I said, their preclinical development to just within like 1 year to 18 months, instead of like 3 to 4 years of development. And they were able to do it at much lower costs. And the key lower cost here is like, less than $3 million. That is something that you will never heard about prior to this. And the key thing is that they were able to eliminate the guesswork in drug discovery to be able to achieve such significant milestones. So the other thing, similarly, in the diagnostic world, we are seeing interest in this area as well. So you will see that AI in diagnostic has grown to 424.4 million. Although again, it's still a very insignificant size compared to the 63.3 billion diagnostic market, but you're seeing that it's growing at a significant rate, expected to grow at a significant rate. So artificial intelligence is now, when years back, it's something that people are cautious around. It's now becoming more synonymous, and they are gaining support from the medical community. So from a technology point of view, they are viewed with less suspicion than before by the medical professionals as they continue to prove their ability to diagnose, right? Or to assist in diagnosis. So how this AI is treated is, instead of being treated as a threat to the medical profession, they are treated as the second pair of eyes that never need to sleep. So then in this case, the medical professionals can work on more high-end critical function and allow for the diagnosis to happen at the AI platform level. So we have seen a lot of examples in this, like for instance, in the diagnosis of cancer, the flagging the acute abnormalities. We in fact have invested in one sepsis AI sepsis diagnostic company based out of Pakistan. There are companies that are predicting stroke outcomes, cardiac conditions, and all sorts, right, of chronic diseases. The key, the one area that is ahead of all these other AI diagnoses is basically in the imaging sector, because again, these are one of the earliest vertical that was looked into in terms of AI diagnostics. And these companies were able to benefit the medical medical centers or medical professionals by offering speed, accuracy, early detection, and detection of things that you are not able to detect prior to AI. So let me just give you two examples of companies like this. One is Viz AI. Viz AI is a deep learning algorithm that detect potential strokes, and they achieve regulatory approval in both the Europe and the US. What they do is, what this program does is designed to identify suspected large vessel occlusion strokes. So they would then send a message to the specialists who would view and confirm and decide on what are the emergency treatments to be made. So based on the study of 300 CT scans analyzed and their comparison to the performance of the software with that of the neuroimaging specialists, resulted in faster detection, 95% of these cases, and saved an average of 52 minutes. So 52 minutes for potentially a stroke patient is very critical, in fact, right? So another FDA-approved diagnostic, which is QuantX, again, another imaging AI imaging platform that uses machine learning and advanced image analysis with deep learning database of historical cases to assist radiologists with the diagnostics of breast cancer. And for them, they are able to achieve 39% reduction in overlooked cancers and a 20% overall improvement in diagnosis. So these are the trends that we see that's happening around the world today. So any questions before we moved on to intellectual property?
I think we should take a short break, Ross. I think it's
5 minutes.
5 or
Okay.
10 is up to you.
5.
Okay, sure.
Hi, Kim. Can we start now?
Yeah, not sure everyone is back, but I think you can start.
Okay, so let's now we are in intellectual property. In considering your IP, you need to consider as in per product, per strategy. You also need to consider how this applies to the overall strategy of the company and how this is going to impact your funding, right, needs. So in developing your IP, and I would call it your IP toolbox, you need to ensure that it fits the company's business objectives. Just a bit of history on how this came about. It really, traditionally, it was known as industrial property, covering patents, design patents, industrial designs, utility model patent, which is sometimes called petty patents, and plant patent. And it also covers trademarks, service marks, layout designs of integrated circuits, and protection against unfair competition. Then in the modern definition, it changed, which we now know as intellectual property. Intellectual property covers everything that industrial property covered, above and beyond that, including copyright that was never included in the beginning. One thing about patent, it started off traditionally as plant patent, right? Granted to inventors who have discovered or invented a sexually reproduced distinct new variety of plant other than the tuber that you propagate. So and that is basically where patents started and evolved to what you see today, which you would be more familiar with, for example, design patent and utility patent. Then let's talk about copyrights as well. Copyrights traditionally has been more about authorship, right, of traditional works like novels, poems, music, paintings, cinematographic works, photographs, and even texts of scientific papers. But now it's more commonly associated with computer softwares, which we will discuss a bit later on in the slides. So each country as a legal jurisdiction would have their own set of principles and practices applicable to IP. Although they have a lot in common, there would be variation as well. So for instance, I would cite one case in 2013, which was basically determined as patentable by the Federal Court of Australia, but not by the United States Supreme Court. So you see this example of where the jurisdiction and different countries differ. So this case was on the isolated polynucleotides, which embodies naturally occurring genetic sequences. And you will know why later on in some of the case studies that I would share. So to gain a competitive advantage, your company will endeavor to provide something unique. If the technology you're implementing is an in-house discovery that can't be reverse engineered by analyzing the product, what would be the first choice? So it's not easy to be a reverse engineer. The natural choice would be to keep this as trade secret, right? While an industrial secret or trade secret is a technical knowledge which, because of the competitive value that you've identified for the company that you wish to conceal, the know-how is instead a set of knowledge or activities developed by an individual or even by the company as a whole that was acquired through experience and research, and also would be difficult for third parties to imitate. So know-how, unlike trade secret, do not have the essential characteristics of, as named, being secret. As the fact is that if it's disclosed, it does not mean that it is no longer considered as a know-how. So that's the difference. But eventually, when you evaluate the IP as a whole, you'll need to consider this, right? Would your technology become publicly accessible eventually? And if it is so, and something which you cannot avoid, then patents would be something that one would naturally consider. So patents mean open and apparent, and it's obvious definition for that. Why? Because what a patent is exactly is a public document that grants rights to you as an owner or holder of the patent to exclude others for a limited time. So for example, if it's utility patent for 20 years, from practicing the invention as recited in your claims. The patent grant is sometimes viewed, okay, as in exchange for you making your invention public, the subject matter taught in the patent specification, which you would have otherwise kept secret indefinitely. So in exchange for that, you get exclusivity. And this is what all pharmaceutical companies pursue towards and try to extend their patent exclusivity for as much as possible. More about that in the later slides. So typically what you do, how do you go about to file for patent? You file a patent application with the patent office, which intend for you to comply with the various legal requirements. And you need to include disclosure that details your invention, which enable a person that are skilled in that specific technical field to be able to make use of your invention. You will need to provide a written description of the inventive subject matter. And one thing you have to be aware of is that your present invention, which you intend to file, should not be already publicly known or otherwise in the legal term referred to as prior art. You will hear your patent lawyers speak a lot about this. So typically this would include the need to do a patentability search to uncover various forms of pertinent or prior art, not only patents. So even if the subject of your proposed patent claim is clearly novel, okay, you know that it's novel as compared with the prior art when you do your patentability search. Is this sufficient enough for you to establish that the claim fulfills the requisites of patentability? So the answer to this is no, because the court determines what is patent eligible, right? Which means that something can be protected within the patent statute. So in other words, it's not as straightforward as one would think, and we'll see some case studies of that later. So, but the fundamental principle of patent law is that you cannot just merely, as I said, just claim for a novel composition. That is not enough. You need to be able to show that it has practical utility as well. So what types of patents are commonly filed for drug companies or biotech companies to treat particular disease? It is called utility patent. Utility patent application tend to be costlier than any other patents, including design patents, but they cover almost everything, and they protect your invention. So it's something that you would consider, is this something worth investing into in terms of your IP strategy? Then the other thing that you may get confused with is utility model, right? Not utility patent. Utility model is a simpler form of utility patent or patent in general. It grants you exclusive rights for your invention, which allows you to prevent others from commercially using this protected invention without your authorization, and again, for a limited period of time. In basic definition, which may vary from country to country, and again, not all countries have utility model. A utility model is simply just a patent, sometimes referred as petty patent or innovation patent as called by the Australian jurisdiction. So the main difference between utility model and other patents are this, right? This is less stringent. So meaning that you do not require, while it requires novelty, the claim to novelty, you do not require to meet the inventive step or the non-obviousness that is required for the other patents. So there is that lower barrier altogether in applying for utility model. So protection for utility model is often sought for innovations that are incremental in nature, rather than a completely novel innovation. So the term for protection for utility is usually shorter, as again, because you have less stringent step. So for country by country, it varies. It can be between 7 to 10 years. So where the utility model protection is available, the patent officers do not examine applications. And you will see that this is one of the key steps in securing a patent, right? The examination. So they don't do examination of the substance prior to registration. So this, in fact, makes the registration a lot simpler and a lot faster. So you can get this within 6 months as compared to utility patent, which would take years to get. And also, they are much cheaper to get. So why do I mention this utility model if it's only for incremental innovation? Because this could play a part as your overall IP strategy, especially for startups with limited resources to go by. One thing to note though is that there are limitations, obviously, in what can be applied for, right? It can only be used to apply for mechanical innovations, and in some cases to products only. So it differs again by country to country. So why is it attractive for startups like yourself, or SMEs for that matter? Because your patent protection can be complex and costly initially. And for many of you, the patent protection is a must to maintain your competitive edge. So no matter, you need to apply for something. So this could be an alternative in addition to your overall layering of your IP strategy. something that you can bring up to your IP lawyer as well. So sometimes this utility model is beneficial because it runs, you are able to apply this, let's say if you are rejected for your utility patent. There are certain countries that allow for you to instead revert to a utility model. So that gains you a protection of at least another 7 to 10 years, even if you are not able to do that with the larger protection of utility patent. So if patent protection is also being sought, it's considered, it's important for you to time your filing of the utility model with that of the rest of the patent application. And why I say that again, it goes back to prior art, that you do not overstep that. So if you filed the utility model first, is there a potential prior art to that, prior to filing for your utility patent? Or do you file the utility patent and follow up with a utility model for narrower application of your product or innovation? So those are the things that you should bring up to your patent lawyer. Why I'm bringing this up for you, it sounds all confusing, but something for you to start and to try to understand a bit, and to ensure that these are considerations taken into account in framing your IP strategy. There's one other thing when I said about timing, is that utility model can be branched off a pending patent application, as I said, right? So you file your patent first, and then you have you isolate a segment for the filing of utility model. Or you can claim priority from an earlier patent or utility model application as well. I'm sure most of you consider PCT application as part of your strategy. This is something that you could use as the basis. The PCT application can be used as a basis for a utility model application at the national phase, if you think that going all out on utility patent application is a near impossible task. So that's also another option. So in summary, with all this maybe too much information, utility models are more cost efficient, time efficient to obtain, and should be thought of as one of the larger IP strategy for a startup which is trying, like yourself, to manage your capital resources and what goes into patent application. So let's go to copyright. I will touch a bit on copyright here because there has been a lot of, I would say, errors in the past that I've noticed of startups. And obviously some of you probably are in whether software development or AI platform development, right? How does a company own a copyright to the works generated by your employees? In fact, you don't have to worry about that because you, in fact, but you need to check whether in Vietnam it's the same. But in fact, in most countries, copyrights are granted automatically to the company in the works of authorship generated by your employees in the course of their assignments. So it does, and it does not need to be mentioned substantially in your employee agreement, and you will still be granted that rights. That's why I say it's automatic. But one thing that you need to be careful is in terms of the rights that you will get if you were to engage independent contractors. And there's a difference there. So for independent contractors, the copyright is owned by the contractors, And if you would want to have access to the copyright, you must make sure that it is written and assigned in your contractual agreement, right? That this copyright is granted, is assigned to the company. So, or it could be licensed, or they grant you permission to use their copyrighted work, either ways. So you must make sure that the agreement with these independent contractors fully protect your business if you wish to own this copyright outright. So unfortunately, these are mistakes that we see over and over again with startups that have overlooked this, especially, and subsequently have to face expensive litigation or lead to misunderstandings with these contractors. So just a little bit on the process of the copyright, right? What do you need in order for you to prove that you have copyrighted material? As I said, nothing really. You automatically gain that, or you get it assigned if you were to engage a contractor. But there are benefits to have this registered. So you may want to consider registering the copyright, and you may want to consider placing a copyright notice on your work to avoid any misunderstandings, right? So if the work is, if let's say if you don't do this, what are the scenario, right? You may not be able to sue an infringer unless you have in your possession the certificate of copyright registration for your work. And this is something that you can easily register. And it has to be done before someone infringes on your work or within 3 months of the date of your work, which is first published. The other benefits of having this registration is that when it goes to court, when you go to court and sue someone for infringement, you can be awarded the attorney's fees, and you can be awarded statutory damages. And why statutory damages are important here is because it's always hard to determine the loss, the loss of money in this case, right? So statutory damages is something that you could claim if you have registered your copyright. So then the other one would be trademark, brand name, which are all under the same umbrella, or service mark if you run services, which you could also consider, right? If you have not registered, you obviously can only put TM or SM, but then if you have registered, then you could put the symbol of that registration. So how extensive should your trademark search be? I would say rather extensive, because you shouldn't just limit to your local trademark registration and application. You should also look at other foreign jurisdictions, especially the ones where you would want to have a presence or operate. Then you must ensure that the ones that are doing the searches for you, the lawyers that you engage, are looking at direct hits, suffixes and prefixes, phonetic sound and likes, and all these things, right? And they're doing like internet searches as well on possible similar names or looks that could be, that could be confusing to others that see that, right? So those are the things that you want to consider in terms of your trademark process. So after you, so the ideal thing is you register your trademark, and if you register, then 6 months later, it's filed, and an attorney in the patent office would search and register these marks if you are already operating. If not, then you would need to have a statement to state that you have that you are already in bona fide use of this trademark. So those are typically what you need to do in terms of the trademarking. So once you trademark, you just don't do anything for the next 5 years, but beware that in past the 5 years, that means between 5 to 6 years, you will need to file an affidavit that your company is still using the trademark in connection with that same goods and services. Because if you don't do that, then the registration would be cancelled. So typically, what's the patent process? It's pretty step by step. The process of obtaining patents begins with you filing a patent application with the patent office. And when should you file? It is important to file as soon as practicable, because the first person to file would gain the priority over all others, right? So the application would describe your invention, give examples of how it can be used, and usually include illustrations like schematic diagrams or graphs. So filing swiftly and also thoroughly are important. You as an inventor cannot add new information once you have filed the patent application. So the registered patent attorney or agent acting on your behalf, or you yourself, would file this patent application with the patent office. So once this is filed, then the patent office examiner with the technical training in that respective field of your invention would conduct a prior art search and determine whether the application satisfies the legal requirement for patentability. Then he or she would issue an office action setting forth the grounds of rejection. So typically this would happen always, and then the applicant or your representative would respond by amending these claims, submitting your arguments, or doing both to overcome the rejections. The details and timeline will be showed in a couple of slides later. So the reviews, the response the response and allow you to claim or issue, they would issue another office action. So this goes on back and forth until they issue a notice of allowance, or you decide to abandon the application if you think that's just no way that you would be approved. If necessary, the examiner's decision may be appealed to the Board of Patent Appeals and Interferences, and perhaps even to the court. So issuance of the patent confers on you as the applicant the right to exclude others from making, using, selling the claimed invention for 20 years from the date of the earliest application in that specific jurisdiction where you filed. And then from then on, you will need to pay for the maintenance fees, which is basically just an administrative fees for this to retain this patent. So what is important for you as a biotech company, especially those that are in clinical, that goes to clinical trials, is the knowledge that this is just a 20 years monopoly, which would be granted to you in exchange for your public disclosure of your invention. And do note that the average approval time, it takes years, and it could be up to 3.5 years. So in this case, what is the rate limiting step in this whole process? It's really the preclinical studies. Because clinical trials obviously cannot begin until there is sufficient data to justify human testing. So as many preclinical studies should be performed as early as possible, and preferably before a patent application is filed. As the result of such studies will be able to support your claims for the utility of an invention. So this is a preferred route. And why is that? Why should you file your patents before you go through that process of seeking FDA approval? The first is that the patent application has a lower standard of safety requirement than the FDA. So it means that you just need to demonstrate that your product has sufficient probability of safety in humans, but you do not need to provide clinical evidence as if you were to go through the FDA process. Next is that the patents are important IP safeguards. So why is this? Let's look at this scenario, right? If you as a company, you begin your clinical trials to begin the FDA process before filing for a patent application, another company may come along and could patent this exact invention before you. Then what happens? Then you have to turn around to this company to license this particular product or biopharmaceutical, whatever not. And you will lose your royalties, your market exclusivity, and your company value in the process. Or you could opt to abandon this altogether, and then you will lose the millions that you have spent on R&D. So even if there's no company as such that comes along to patent this product, you must be careful not to disclose the invention, because otherwise this would mean that you would have to file the patent within a year before it enters the public domain. The other reasons, which are this, I would say, like the soft touch of filing a patent before beginning your FDA application, is that the FDA approval is accelerated for patented compounds, and patents would attract the notice of potential investors who can provide the capital to fund your clinical trials. So it's like a cycle. So ideally, preclinical studies should end before or concurrently with your patent issuance, and FDA clinical trials should begin immediately thereafter. But before clinical trials can begin, you would need to turn on several documents to the patent, to the FDA, right? Or whatever local drug authority that you have in your specific markets. So this could be the quality of the verification of the quality of the data, the demonstration of compliance of the investigator with all regulatory requirements, scientific journal publications, in vitro animal data studies, trial subject information, even the financial analysis of the potential of this product, and the lab protocol. Then the FDA or your local regulator would review and approve these documents before clinical trials can begin. So as mentioned, the filing of the patent should be done first, or you would run the risk of missing the 1-year deadline for establishing priority of invention. So one thing to note about this is that if this is filed, your patent deadline, right, or term can be truncated under this terminal disclaimer clause if it runs alongside another related patent. So, but fortunately, there are other means for you to extend your patent runway. One is through patent term adjustment. And this is possible because perhaps the patent office took too long in some phase of the patent prosecution, even though you've acted with relative diligence, or because the grant of the patent was delayed by an appeal or an interference proceeding. Another way for you to extend the patent term is through what we call the patent term extension. And this is due to the delay of marketing of a product because of the delay of FDA clearance. So for a drug first approved for marketing, the term of patent covering the drug can be extended for up to 5 years, provided that you meet certain conditions. After the patent term expiration, the patent term remaining at the date of the FDA approval cannot exceed 14 years. So application for patent term extension must be filed within a certain time limit after the approval. So I mentioned here FDA, but other countries like EU, Japan, and others have similar process like this, which you could follow. One thing to note is that why do the pharma, when you come to this stage, right? And even investors that you talk to, why is patent strategy emphasized a lot? And why is it such a big concern for farmers? It's really about maintaining that market exclusivity for as long as possible. So they pay attention a lot to your patent strategy. And why it's such? Because once the patent expires, generic drug companies start to capture the market, which was initially exclusive to that pharma. And studies have shown that they capture like 57.6% of all the expired patents. So this cost the pharma millions of dollars, right? They spent on the development with millions of dollars, and they want to make sure that they are able to retain the exclusivity as much as possible and be rewarded for the risks taken. So there must be adequate patent exclusivity for this new drug to incentivize the investment into drug development. And why? Because patents stimulate innovation and reward risk taking. But unfortunately, at the same time, the generic drug makers benefits from certain act, which is, I think, in the US is the Hatch-Waxman Act, which basically allow them to challenge drug patents long before the expiration dates. And they do that with as minimal costs as compared to the development of de novo drug by these pharmaceuticals. So this has become a headache for the pharmaceutical, and also this generic drug is basically a copycat of the brand name drug, right? You have the same active pharma ingredient and is supposed to be an bioequivalent. You get approved by the FDA pretty fast using the abbreviated new drug application and relying only on preclinical and clinical data that was developed in the de novo development by the pharmaceutical company or the biotech company that they licensed this from. So the key thing is how do we overcome this? In most cases, you'll be advised to make as broad a claim for your IP protection. But in this case, you would be advised to make as narrow a claim as possible to get the adequate protection against this generic drug competition. So Innovative drug developers, right, and as the starting point, should never overlook the incremental inventions, and you have to endeavor to obtain patents covering as many as possible novel inventions. And we call this sometimes the layering of patents on top of one another. So you have to seize every opportunity to seek patent protection on all drug-related inventions at every stage of the drug development process. So in this way, a comprehensive patent portfolio may be established to provide multiple layers of patent protection around the new drug. There's one thing to note, like let's say if you have a new chemical entity, you have to take note of when you should publish this particular structure or identity of this new chemical entity. The preference is for you to postpone the publication. I remember earlier on when I said that biotech startups pay attention a lot to IP, a lot to the validation of data, but less so on the publication. One of this reasons is this, because the advice is that you should not publish until you have reached phase 2. Why? It's because your publication can be construed as a prior art, and that would interfere with your patenting later through this incremental invention. So delaying publication of this chemical structure may reduce the possibility that third parties experiment with the same compound and publish or seek the patent as a result. So publications by third party would also create prior art that would interfere with your patent filings. So third party patents may interfere with your patent strategies and even impinge upon your ability to have that freedom to commercialize the drug eventually. So this is something that one should be very watchful of. So why again, layering in summary is that, and why pay attention to patent term adjustment, patent term expiration, which extends your patent term, is that for you, the most profitable, or for the pharma that eventually license your product, the most profitable is to delay the approval of the generic drug, because once they come into competition, they will eat away at your market share. So you want to make it as difficult as possible for the generic drug companies to get this abbreviated new drug application approval. And how do you do that is, as I said, by layering. So if you have many on the list, that creates more barrier to the generic competition. Now, what is the PCT timeline? Something that is important, especially in today's world, right? Where you are expected to expand to other countries, not just your own country. So the benefit of PCT is that it provides a way whereby your single patent application, mostly in English, can be filed to start the patenting process for any other countries that are part of the 148 members of the Paris Convention that are designated. So there's a checkbox mark, PCT application, which countries, and then you pay accordingly as such. So this gives you the ability to basically extend your IP, the patent filing expenses to later periods, right? By using the PCT convention. So how long can you defer? It's basically 30 months. And you and most would differ because of the initial high cost of directly filing foreign patent application. And this gives you enough time to evaluate the market and also to obtain financing. So the strategy is for you to file a patent application in your own country first, or in key market, and then to file a PCT application 12 months later. The cost for even this PCT application is between $3,500 to maybe about $10,000, depending on the number of pages, the revisions that you need to make, the drawings and the text that you need to file. So under the PCT procedure, everything would start at the priority date of your filing at the national, the original national application. So after 16 months from that date, the International Searching Authority examiner would issue the results of the patent search for the claimed invention, plus a written opinion on the patentability pursuant to the international standards. Then the PCT application is published with the International Standard Report 18 months after the priority date. So at 18 months or 2 months from the International Search Report, you can optionally amend the claims. And at 19 months, you can optionally request supplementary international search that are not covered prior to this. So you can also optionally file a formal demand for an international preliminary examination within 3 months after the international search report, or 22 months from the priority date. So whichever that is later. During the examination by the authority, you can get one or more chance to respond with an argument in favor of patentability and the option to submit your amendments to the claims. So most countries, the 30 months from the priority date is a crucial time. This is when your PCT procedure ends and you would need to submit for entry into a national phase patent prosecution. And as I mentioned, it could be a utility patent, it could be a utility model following this PCT application or whatever other patents. So this means that your application is translated into local languages and filed at the local patent office. So if there's a need to translate, usually there's a window of an additional 1 month. If not, then it's 30 months. And the cost could vary. So if let's say there's no translation required, it could cost as much as 1,500. But if let's say there needs to be a translation, and it costs about 6,000. So in other words, let's say if you want to file in 24 countries, for instance, then you would require as much as 100,000 investment into patent application alone. This is not considering the legal advice or fees that would be incurred along the way. So let's go into details of the patentability, right? If you look at this, what is patentable? And I read this out, right? A method of diagnosing disease X comprising determining the presence or absence of a biomarker Y in patient, correlating the presence or the amount above a level W of the biomarker Y with disease X in the patient. The answer is that this is not patentable in the US, but it is in most parts of the world. So before before 2012, and this is based on the decision of the Supreme Court, the US Supreme Court, on a case in 2012 between Mayo and Prometheus, which I will touch on later. So before this case, it was commonplace to obtain a patent claim to a diagnosis method based on newly discovered correlation. But after this case, this has become ineligible for patenting. So you can see that the patent landscape is ever changing. This was not even a decade ago, right? So details about the Mayo versus Prometheus case. This arose between Mayo Collaborative Services and Prometheus Lab. Both are diagnostic test lab, for-profit labs, although the Mayo Collaborative Services is a subsidiary of the Mayo Foundation for Medical Education and Research, also affiliated to Mayo Clinic. They are a for-profit entity. So, and Prometheus was at that time recently acquired by Nestle. So both had commercial interests in this. So what was the issue of contention? There were two patents in contention owned by the Hospital St. Justin in Montreal. And the patent concerned the use of thiopurine drugs in the treatment of autoimmune disease, such as Crohn's disease and ulcerative colitis. So different people metabolize these drugs differently, meaning that if your dose is too high, there may be side effects. If your drugs is too low, it may not work. So when the patents were filed, these metabolites were already known, especially the 6-thioguanine. So the scientists at Hospital St. Justin instead identified the threshold level for effectiveness and filed for this patent protection specifically, meaning the methods to use the threshold level to determine dosage. So Mayo was rejected twice, and then they appealed again, and then finally the Supreme Court agreed to take the case, and they made a unanimous decision that the correlation between the naturally produced metabolites and therapeutic efficacy and toxicity to be unpatentable. Okay, so this changes everything because prior to this correlation between the metabolites and therapeutic efficacy was supposed to be patentable. So then the US Patent Office followed suit and released a guideline which support this case practically. So that leads to US being one of that few countries that basically makes it difficult for diagnostic companies to patent their invention. There are ways to get around that, but it has been difficult mostly, and especially in the post-human genome project era, right? As most of these proteins have been sequenced and coded and are known to the public. In other words, these are no longer patentable as novel molecular entities. The advent of personalized medicine at the same time makes this still very attractive to investors in the industry. But then at the same time, this customized approach depends on molecular diagnostic tests to determine patients' genetic or molecular markers, which again are correlated to clinical useful disease characters. So again, that correlation is again in question on the terms of patent eligibility, especially in the US. But then if you look at this, right, what are the fundamental components of diagnostic tests, especially one is that you have biomarkers to be detected, and two, the correlation between the biomarkers and disease characters. And patent on both are now excluded, meaning that it's no longer patent eligible in the US. The good news, though, is that it's still patentable in other parts of the world. So then it becomes painful for the inventor, right? You put a lot of investment, you put a lot of risk into developing, and now what? You are, especially in the US, you are blocked from being able to patent, right? Like give you an example, I gave you the case of Mayo versus Prometheus in the correlation between biomarker and disease. When did these isolation genes become no longer patentable in the US? It came from the case between myriad genetics and other in terms of the BRCA1 and BRCA2 genes. Initially, they were considered patentable. They were granted the patents for these isolated nucleic acids, including those gene sequences. But then in 2009, a group of plaintiffs, especially from the medical associations, clinical geneticists, claimed that they are in fact not invalid because these isolated genes have the same sequence information as the corresponding genes or mRNA in cells and are products of nature that are ineligible for patenting. So again, similarly, in the end, the Supreme Court unanimously decided that based on the case presented to them, that isolated genes are no longer eligible for patent protection because they are not new with markedly different characteristics from those found in nature. So that's the key. So again, it makes that very difficult for diagnostic developers to gain that upper hand through patenting. But there are ways in order for you to overcome this. One is to make sure your application is kept as broad as possible. So this runs in contra to drug development, where you want to keep it as narrow as possible to weed out the generic drug manufacturers. Here, you want to keep it as broad as possible because you do not have a strong patent protection for biomarkers. It would have been important to obtain broad patent protection as such for this application of the correlation in diagnosis. So you need to be creative in this. There are ways and examples that we have seen in the recent past, including if you want your novel protein as a biomarker to be detected immunologically, you could use a protein antibody complex instead, and that would become patent eligible if it does not exist in nature. Or you could use artificial complex like mRNA, miRNA with a primer or probe if the complex necessarily forms a diagnostic test. Then you could require, if the test requires multiple biomarkers, such as prognostic gene signatures, you can, a composition comprising of 2 or more biomarkers can be claimed. Although such claims may be circumvented by a separate measurement of the biomarkers before combining the results in same computer algorithm. And some have even patent the diagnostic kits containing combinations of multiple components required for performing diagnostic tests. So these patent claims are not as strong as the earlier, where you could patent the compositions of matter claim, the correlation of component to disease. They do provide the extra layers to protect your invention. So I would touch a bit on companion diagnostics because this is becoming a lot that you see a lot in treatments, right? a companion, especially with the event of personalized medicine. Companion diagnostic is a medical device, or it could be a test, which provides information that is essential for the safe and effective use of a particular biological product that would be tailored to a targeted drug treatment. So in this era of companion diagnostic, the diagnostic method claims may be alternatively drafted in the form of method of treating the disease. So in this case, this method of treating breast cancer, this is hypothetical, comprising detecting HER2 expression in a breast tumor tissue sample from a patient using an antibody immunologically reactive with HER2 protein, administrating trastuzumab to the patient if HER2 expression is detected to be positive. So this is an example of a claim. But can this claim be infringed on? Infringe here means that can this be violated? The answer is that yes. The answer is no. For this reason, right? The key is you look at this: the detection and the administration are basically most likely done by two different entities, right? So when such an event happens, then the patent claim cannot can be infringed on only if the steps in the claim is performed by a single entity. But this is not the case if there are two entities performing these two different steps. So under this rubric, right, it would appear that none of this is infringing on this patent claim. So this is something that companies that are developing companion diagnostics should be significantly aware of, that there could be such a misstep. Now that we have a basic exposure to what can be patented, what cannot be patented, both in drugs and diagnostics, we want to look at who in fact owns the invention, right? So this is an actual case between Citus and Roche in terms of the PCR application. So in 1988, Citus collaborated with Stanford University on the test of the efficacy of new AIDS drugs. And then at that time, Dr. Holotny joined the Stanford University as a research fellow and signed an agreement with Stanford. He agreed to assign to Stanford his right, title, and interest in inventions. And on this basis, Stanford filed and obtained 3 US patents relating to the invention. Then he later assigned Citus to Citus when he was later assigned to them, right? He was again asked to sign an agreement that he will assign and thus hereby assign his right, title, and interest in that ideas, inventions, and improvements made as a consequence of his access to Citus. So who now owns the invention? Is it based on the first to be assigned as the claim and rights to the patent, or is it the second that to be assigned that has the rights and claim to the patent? Shockingly, it was Cetus that basically laid claim to this invention. The University Technology Transfer Office, which most universities would have, that deals with your licensing and also your spin-off corporate agreements, had a rude awakening when it sought for patent royalties for the HIV test that generated from Roche. Then Roche counter-argued that Cetus document governed ownership of the invention, even though the inventor had signed it after he had signed the Stanford University document. So why is this so? How did they secure a win over Stanford University? The clue lies in this, right? Agreed to assign versus the will assign and thus here assign. So this is a case where you need to pay attention to how it is even worded. One is of future and present tense, and the other one is just it's not the case, right? So as a consequence, the Supreme Court decided that Cetus rather than Stanford had acquired the right to patent an invention by the Dr. Holodny, which applies to the PCR technique, which I mentioned just now. So even though he had agreed to assign earlier on to Stanford, because of the way it's worded, and I say the present tense, it was effectively to the courts that this would mean that he has immediately, upon signing, transfer his rights to Cetus instead. So even if later he did sign another document with Stanford to assign his ownership rights to his inventions, it was already too late because he has divested these rights to the Cetus based on how basically the term was worded in the document. So what is the takeaway here? So when you draft or negotiate or sign contracts involving complicated IP, right? Beware that even a single word could make the difference between owning and not owning a rights to a valuable tag. So you should talk to your IP lawyer. You make sure that they review the boilerplate forms and make sure that this boilerplate form embodies the latest version of language that the courts have held to be effective. Now, talking about collaboration, there's another thing that we would want to look into. You, as a startup, would most likely have to collaborate with a lot of companies, researchers, or universities, right, from different locations. And then there's this thing called the secret prior art, which then disqualify you from the protection of your invention because of the involvement of different people contributing to this invention over a time frame, especially if they work for different employers. So be careful of this as well. And in order for you to avoid this pitfall, you need to make sure that your joint research agreement is in place before the patent application or patent claim. And this agreement must be properly worded into the patent application. So let's go into AI diagnostic. It is a bit more interesting, a bit different. So to start off with, we know that the diagnostic approach for AI is based on deep learning, which is based on the use of algorithms to train neural networks to recognize patents. And how do they do that? They basically trained your neural network on historical patient data for which patient outcomes are known. And once this has been trained, it is used to generalize their knowledge so that when presented with new patient data that has not been seen before, it is able to compute a prediction of the patient outcome. So this something that is potentially patentable, but there's a catch because you need to navigate through two exclusions. The first exclusion is the mathematical methods and computer programs. And the second exclusion is that diagnostic methods conducted on human or animal body. And these two exclusions are not patentable. So let's look at the first, which is computer programs and mathematical methods. And how do you overcome this hurdle? The first step is to determine if the subject matter in question is directed to technical subject matter or not. So it's pretty straightforward if it's directed to, say, for instance, an apparatus like a computer server or to a computer implemented method, then you can pass through this hurdle. Then the second is it directed towards a non-obvious technical solution of a technical problem? So it means that only features which contribute to technical character of the invention are taken into account. So that the second hurdle is difficult to pass when many of the features of the patent claim relate to features which are considered to be non-technical. So you'll see most of this, right, in the market, like into administrative or business methods. So AI-related innovations should be described and claimed as being developed for specific implementation, technical purpose, and this will assist you in overcoming these two hurdles for this first exclusion. What about the second exclusion? This is more straightforward because all you need to do is to make sure that at least one technical step of the method is carried out in the absence of human or animal body. So for instance, it's carried out in a computer. Should you apply for a patent for that new AI idea that you've been working on? There has been contradictory views on this. Some believe that you should apply for a patent portfolio, while others recommend that you should not. So how best to work on this is that overall you need to look at the bigger picture, what provides the best leverage for you based on is your invention widely used, easy to detect, hard to design, truly novel or inventive. So there are various considerations. One is that patent protection account for the ethical benefits that you can accord to your clients and stakeholders. So why is this so? Patent applications are generally published around 18 months from filing initial patent. And by that time, it includes detailed information about your algorithm with enough detail to enable whoever that reads it and understand it to implement the invention. So it means that it gives full transparency in regards to the technology. To the regulators and public, this is something that they want because it assures them that the technology works and it gains their trust, basically. So this, you could consider that in exchange for the patent protection, you are giving your rights, you're giving that away the transparency to this community that places a lot of emphasis on AI ethics. The other consideration is that you will see that a lot of these patent applications are populated by large tech companies like Google, Amazon, IBM, okay? And this basically result in some smaller, less patent-focused firms to become worried that they could be shut out by the emerging technology. And some of these some of these companies go as far as to be litigious. They would actually file patent lawsuits on competitors to basically weed out competition. So this creates a lot of fear in founders because of that potential litigation by a deep-pocketed company, right? A company with deep pockets, with a lot of money. The good thing is that there is still a lot of white spaces available. So there are niche areas that you can focus on, which these big companies are not focusing on. So the thinking is that you should look at things that are basically untapped. Then the other thing is that it's not easy for these patent holders as well, because they could easily be challenged based on today's act and law, and they are more difficult to get in terms of getting patents. So in other words, you shouldn't cede the AI innovation to the big guys and just watch them taking the larger pie of it. You shouldn't count also on challenging patents and getting them overturned. That requires significant amount of resources. But instead, you should focus on your own AI tech and build a niche market opportunity around it. And by doing so, you can use this as a bargaining chip in licensing deals or legal negotiations with other AI vendors. While these large companies may focus on quantity of patents, what you should be focusing is on quality of your invention. So instead of filing 10 to 15 patent applications on one particular solution or device, which is common, you should be looking at just 2 to 3 and focus on developing it to usability. So another downside of patent application, as mentioned earlier, is that you disclose your invention to the public. So instead, if you feel that this is not something you are comfortable with, some actually choose to keep this as a trade secret to protect their technologies. So they leverage on trade secret laws instead. And why so is that it is generally understood that AI is hard or impossible to reverse engineer, in particular if it's implemented in the cloud and provides the secrecy is maintained. So AI inventions are in fact good candidates for trade secrets. Okay, so long as you maintain that it is not easy to detect, that it's has low staff turnover, you have robust cyber security, and that you limit your external collaboration. So ultimately, it's you to decide whether to go for patent or trade secret strategy. This is something that has always been in consideration even before the advent of AI, as those with the software innovation. One thing to note is that for AI, there's already an abundance of prior art. Why I say this? It's because it has always been part of the academic field. AI is not new. It is new in terms of commercialization with the recent computing technology, but academic has been working on this for many years, I think since the 50s. So in other words, there are a lot of prior art lying around, which makes it very difficult for you in terms of defining what is patentable. overall, given this complexity of technology and the fact that output of AI and machine learning contains very little information on computations used to produce it, and in particular in contexts of processing that can happen safely out of the scrutiny of the cloud, it makes this detection of infringement even more difficult for AI inventions, and which means that the ability to enforce will also be challenging, as mentioned earlier. So given this transformational nature of AI, and to encourage investment in dissemination of information application, it is always desirable to ensure that AI and machine learning as a whole be recognized as a technology in its own right. However, I think the patent offices are still far behind on this. So for an example, where mathematics is an exclusion, it is not such for abstract technology like cryptography. So why is it not an exclusion for cryptography, but it is AI? Is a question that we would ask these patent officers. So it is what we hope for is that as more and more innovations come about in AI and machine learning, that patent officers would also move in time with this and recognize this growing economic impact in this field, and to adapt to this invention and claims, right? Then there's also this, just a slight tidbit, that can AI be a legal inventor? As we know that it's self-learning, they have the ability to change over the course of time from what they were originally designed and programmed. Then this started to raise the question of whether AI could develop new technology that the original inventor cannot reasonably say he or she truly contributed in terms of having taken part in inventing this. So this premise is not something like you see in science fiction. I mean, it's happening today, right? And in connection with this again, then it goes to the question of who is legally liable to the actions of AI? Is it the inventor or is it the AI? Obviously, today there's no act of AI which basically excludes liability to the inventor, but these are considerations that need to take in place as AI becomes more commercialized in various sectors, including the healthcare sector. So the answer to this today, can AI be legally an inventor, is no. The patent office in US has ruled that out. So did the patent office in UK and in Europe. And this is with the recent claim by this AI system called Dabus on two applications. One is food container and the other one is flashlight, right? So their claim is that the US Patent Office claim, as well as that of Europe and UK, is that AI is not human-like. So whoever pronounced like himself and herself, we don't use that term for AI. So the group behind the application argued that references to an inventor as an individual could be applied to the machine. But under this current law and with this new ruling, only natural persons may be named as an inventor in patent application. But you see, the interest group, the Artificial Inventory Project, and many others, they're not arguing that AI should own a patent, but they should be listed as an inventor. And one of the other reasons is that because you're expecting thousands to work on a system. So for example, like the ones you see with IBM Watson supercomputer, does that mean that all are inventors? It's impossible, right? So if no humans was involved closely enough with an invention to claim credit for it, then they fear that it would be impossible to patent this eventually. So their argument is to allow AI to be an inventor that would incentivize innovation, because when they are listed as an inventor, these machines will be recognized and it will add value to the invention. So unless the law changes, but today it's still as it is, AI is still considered an inventive tool and it's not an inventor. And it's still being debated as today on the frameworks and system around AI, whether potential protection for the actual machine created work or invention is needed, meaning that whether AI can be an inventor or creator within this existing IP framework, whether there's potential protection for AI algorithm and software, and potential rights concerning the underlying training data and data inputs. So I think I will stop here. We can continue the rest of there's one left, which is product lifecycle management in the next workshop. I'll take any questions if anyone have questions now. Any questions? Too much info? No questions. You understand everything. That's really very good.
We have questions.
Oh, there's a question.
You might to re-explain who can be the best fundraiser in a team?
Okay,
you
if
get
you
the questions?
ask who is the best fundraiser in the team, right?
Yeah, I think it's related to the team part.
Okay, so if you ask me, I said everyone has to be involved in fundraising, but the person that connects everything together is usually the CEO. If you have the CFO, that would be the CFO, because in biotech, they also pay attention to your financial market analysis and projection, which is something that the CFO would be adapt to, but you would not have a CFO in the team until you normally raise a Series A. So if let's say prior to Series A, then I would say the CEO takes the lead. But again, everyone has to be involved in the fundraising. And if you have advisory board members or mentors, that is the time where you would want to leverage on their knowledge and experience to help you in putting together even the slides and also the financial projections. If you are a leader of a project to find an invention, but using funding from the university, so who will own the invention? I think this depends on universities to universities, but what I see a lot is that usually the the ownership is shared with the university and the inventor. So there's a certain percentage that will be owned by the inventor and another percentage by the university. This is what is commonly in place. But in certain places, in universities or in countries where they want to promote aggressive innovation or aggressive commercialization of innovation, the rights usually belong entirely to the inventors. I'm not sure whether Vietnam is the same, but so there are differentiation depending on where you come from. In AI related project, we need to spend a huge amount of money for the data to train models. What could be the best tool to protect our training data set? Okay, to be honest, I wouldn't have an answer to this. In terms of what is the best tool for protection against your training data set. You may want to refer to someone else to answer this question. Or are you talking in terms of the IP? If you are talking in terms of the IP, then I would say initially, it really varies. It's very hard to say. If let's say your AI application addresses the masses, then I would ideally say that you should go for patenting. But let's say if it's very specific, it's very niche, and again, and you have very limited people working on this model algorithm, you are able to control where who has knowledge of the data and of the algorithm, then I would say you can keep it as a trade secret. But eventually, I would recommend as you have gained resources, financing, patent is something that you would and should consider given the aggressive nature of the those in the field in AI ecosystem. You see a lot of companies are trying to defend their rights, to whatever claim by patenting. So you do not want to eventually be falling behind and be a subject of a litigious action by another party that lays claim to your invention.
I have a question.
Yeah.
I want to ask why we're working as a team, including the researcher and the investor from the company. But the role of the two is both important, but sometimes there is conflict. For example, the investor, the one who earn money or open the market, say that, oh, their role is very important, and the technical or the patent each play a small part of it. But the researcher or the inventor say that, oh, my inventor is more important. So how to solve that problem, and the both sides can work together for a long way, because no sooner they will have some problem like that.
Okay, sorry, I don't understand you, but Kim, can you help to rephrase that?
I think it's the role of the team members, I guess. What's the question, chị Thương?
Có nghĩa là trong một cái team làm việc á, thì ví dụ như những người làm nghiên cứu thì thường hợp tác với các doanh nghiệp để chuyển đổi cái phát minh của mình ra ngoài. Thì đôi khi cái người làm cái công việc kết nối đó, hoặc là họ sẽ build up cái sáng chế đó lên, thì họ nói là vai trò của họ đang quan trọng hơn. Thì yếu tố kỹ thuật nó chỉ chiếm một phần nhỏ, trong khi những cái sáng chế thì họ lại nghĩ là cái key nằm ở chỗ là cái phát minh sáng chế của họ. Vậy thì làm sao để mỗi bên nhận thức rõ cái giá trị của mình, và ví dụ như là mình lần trước mình cũng có hỏi về cái định giá công nghệ, bởi vì cái đó sẽ trả chính xác nhất cái vai trò trong cái chuỗi đó như thế nào. Ví dụ như Open một cái kiếm được một cái số tiền đấy thì cái anh phát minh sáng chế 10% hay 20% hay 30%, và cái anh đi bán cái công nghệ đấy hay là để build up một cái startup đó và để định giá lại công ty đó thì bao nhiêu %. Thì làm sao để giải quyết được cái mâu thuẫn này thì cái mối quan hệ đó nó mới kéo dài và mới đi lâu được, chứ còn không trong group thể nào cũng sẽ có cái mâu thuẫn.
Okay. So the question is about splitting roles and responsibilities between the team members. So some of the connectors between the researchers and the covers think that are more important than the inventor. But so how can let's split between the equity shares and then the roles and responsibilities? Because some would say that the roles of connectors or on the business side would be more important from the inventors, and she hinted about the evaluation of the IP to see that who's will be the more valuable in terms of the role of responsibles and the responsibility as well of rolling out to the business. So I think could be your suggestions on how splitting roles, responsibilities, and then equity shares.
Okay, so I would say, to be honest, when you first start, there's only 2 or 3 of you, which is either the business and the technical person. And yes, it's always a contentious issue on roles is pretty straightforward. If you are technical, you focus on technical, and if you're business, you focus on business, including fundraising. And you work together hand in hand to make sure that you get the product to whatever valued milestones that you need to get it through. The question then goes to who should own the bigger equity pie? Is it the inventor, or is it the business person who is also the founder in the team? It's always it's always argued a lot, and some of them just split equally 50-50. Let's say if you have 2 people, or split 3-way, it's not the right way to do it. You have to properly sit down and talk about it. So you have to look at, you have to weigh, right? What has been the contribution so far? If you have contributed significantly as an inventor and you later bring on this business person later on down the road, not immediately, then obviously in terms of the contribution in the past, you actually have a greater weightage. And then you sit down and discuss what is the future direction of the company. So if, let's say, the future is really focusing on a lot more on commercialization, then the business person who you think would be the contributor would have a greater weightage under the future contribution role. So those are the things that you need to consider. And it's always good to eventually, when you decide roughly on what needs to be done, to bring a third party into the discussion, whether it's your advisor or your director, if you don't have an advisor or mentor, to sit down and to sort of mediate this discussion to make sure both parties are happy about it. So the answer is there is no fixed rule as to, of course, if you go online, there's a software to put in like what contribution, and then they churn out a percentage. You could do that, but in reality, there's no hard and fast rule on how do you allocate this percentage to the respective people. It's really down to looking at what was your past contribution, your present, and what's the future, and deciding through discussion what weightage you think or importance that you would like to place, and then you can determine the percentage. What's the other discussion? Who leads the patent, right? The IP. It's actually, in fact, obviously, for a small company, it's the CEO. But in this sense, they need to communicate with the inventor, which likely may not be the CEO, but the CSO or CTO, to ensure that you've covered everything. So but the CEO is not the person that's in charge of the sort of hands-on application of the patent. To be honest, you would likely not have that experience. So most likely is you would actually engage either a consultant or an IP lawyer to help you with this. But again, I mentioned the periphery members. It's always better for you, whether in terms of trust and reducing costs, to ensure that at least one of your periphery members, devices or directors have experience in patent application, IP strategy that would be able to assist and guide you. So that's something that you could do. So if the question is who is leading, it would always be also the CEO, but in communication with the inventor or the CTO.
Thank you.
So meaning that if I have the question is, what do you mean by patent claim to be infringed? So the question is this particular patent infringed on? I think this is going to the, what's this, the, hold on, this is going to the companion diagnostics, right? So I have two things are happening. One is the detection of this particular biomarker. And from this detection, the second thing that's happening is the administration of that particular drug based on the outcome that was generated in the first event. So the thing is, in most cases, this is something that you could protect. And that means if, let's say, this thing happened, and someone would actually infringe on it. But in other cases, these two events are actually taken place or being performed by two different entities. So when it's performed by two different entities, then you cannot actually claim that this patent has been infringed upon. Does that answer? Can Kim translate? So if it's two patents
Okay.
on a new therapy by one single entity, then it would be infringed on. But if it's two patents that are done by two different entities, you cannot claim that it has been infringed on.
Nếu như mà một công ty có hai patent thì sẽ là bị, còn nếu như mà hai công ty hai patent thì sẽ là không bị.
So in other words, there is actually a way to get these are, in other words, it's a weak protection, right? People can get around this claim by basically engaging a different entity in the second step. Kim?
Sorry,
Yeah,
mind you repeat. Yeah.
So this is a way in which basically there's a loophole, right? So in other words, that if you have this claim, if that is done by one entity, then you can actually sue that person for infringement. But if it is done stepwise by two different entities, that means they actually basically they were able to maneuver around this claim, and then you cannot actually sue them for infringement.
Nếu như mà cái hai cái patents này nó cùng một entity thì nó có thể là bị trong cái trường hợp là infringe, nhưng mà đối với trường hợp là hai công ty thì họ có thể là lách bằng cách là họ có thể là ý là đó là cái điều mà lách giữa cái việc mà hai công ty và hai patents ở đây thì họ không có bị infringe ở đây. I'm not sure if I translate correct, but
It should be. Yeah, it's a bit hard to digest, but I think you can reflect on it. But it's yeah, that's the best I could give in terms of answering that question. Anyone with other questions? Okay, so if there's nothing for now, we can stop, and then I'll see you in the next workshop. I think it's in 2 weeks' time. Thank you.
thank you, Ross.
Thank you. Bye.
Bye.
Thank you. Bye bye.
Bye.